Construction of a $15 million health center will commence soon in Phalombe. This is according to Minister of Finance, Dr. Ken Lipenga. Dr. Lipenga assured the House that government has already identified the donor and $9 million for the project has already been sourced. He said the preliminary work is at advanced stages.
I want to agree with my honorable colleague who asked the question that indeed the people of Phalombe are very excited that their bingu has given them a hospital. And I just want to say that government has indeed sourced funding for this hospital. It is from Badea, and in fact only last week a representative of Badea was in my office. And Badea have now given a no objection to the recruitment of a consultant. Between now and the middle of December, we will recruit a consultant. And the next thing that will happen is that the consultant will then advertise for bidders, for contractors, hopefully by January. So by March, we should have identified contractors to start the work. Now, the cost of this project was originally put at $15 million. And the facility that we have sourced from Badea is $9 million. The balance, $6 million, is to come from the Saudi fund. The Saudi fund has in principle agreed to work with us, but they will send representatives sometime in January in order to appraise the project.
We have talked of supply of drugs, and we have also talked of procurement of medical equipment in the country's hospitals. Now here's Dr. Lipenga is talking of the actual infrastructure development in the health sector.
Yeah, it's so much about the youth sector in the National Assembly actually. But like we've said, it actually just proves the point that these are very important things in terms of a human being's life. So that's why these things keep on coming up. Talking about infrastructure development, that's another area that really the health sector has been lacking. You agree with me that when you go into the rural areas, there are even some remote areas where if you may walk for kilometers and never even find even a health facility. The question that really boggles the mind is that where do these people go to find services in terms of medical care?
Yes.
Now, you and me will agree that these are issues that really affect the majority of the people that live in the rural areas. Now, I understand why the minister himself, being a member of parliament for Phalombe East, I think he's quite very excited because really this is the development that is coming not only to a district that he comes from, but closer to home, to home that is. And like we're already saying, the health sector really, just like another very important sector here, education. These are things that really have quite a huge bearing on people's lives, especially back in the rural areas.